This is Athena Jezik, and I'm just going to go over some little techniques of the cranial and lymphatic, kind of a combination of everything, while I just talk to you. And what I'm doing here is it's a hand placement for craniosacral work. It's placed back between the shoulder blades, and it's to release a diaphragm that runs across this area of the body. It's not like the breathing diaphragm, it's a band of connective tissue. And then the other hand can go across here. And it's very light, and I'm feeling for different movement in the muscle. My path has been one to be very, very subtle in the way that I work and what I find in the body. There are a lot of different things that a person can do, and all of them lend towards getting change. Some of them are just more effective for some people than others. My body does not respond well to deep, forceful pressure. And that's even true from a chiropractor. I find very soft-handed chiropractors, and they work much better with my body. I don't like to hurt for a number of days afterwards, although I know that even in craniosacral work there can be a period of stiffness. But I don't like it when it's intense stiffness the following few days. So if you're out there looking for something that you need for yourself, ask a lot of questions and don't be afraid to move around from person to person till you find whatever technique is going to resonate best with your body and what your body's needs are. I'm checking her hyoid bone right now with the base of the skull. And by just touching this with a 5 gram or so amount of pressure, which is the weight of a nickel, I can feel quite a bit of movement happening in the hyoid bone. It's not only going in a more circular kind of a rocking back and forth in a circular direction, it's also like a little teeter-totter. And in that is a floating bone. What that is doing is it's allowing the muscles that attach into that to be able to move a little into a different pattern, into another pattern, and just exercise a little bit. And then I'm going to do just a little lymphatic work. When people come in to see me and they don't have a lot of issue that we need to deal with, they haven't had a head injury or just gotten out of the hospital with surgery or anything like that that needs special attention, I tend to blend the cranial massage and lymphatic work, which people do enjoy quite a bit. They get quite relaxed. I would say most of the people that I work go pretty deeply into a state of relaxation, probably into the theta state, dreaming state, a lot of REM, the rapid eye movement, breathing changes. A lot of people snore, which is a sign that they're very deep. And all that's okay. But what I'm doing here is just a little lymph work to drain the neck and the face. Do some more. And then I'll do a little massage on her face and upper chest and shoulders. Again, this is just pushing fluid. That's all we're working with on this one, is just pushing fluid. This is a little cranial hold. giving space to the nasal bones. People that give facials, or if you get facials, lymphatic drainage for the face and neck are very, very helpful with that whole procedure. Along the clavicle and sometimes in the front of the shoulders here and into the pectoralis muscle. Oftentimes doesn't get worked a whole lot, but it does do a lot of work for us. It too needs to be balanced because the muscles behind can get stronger and these will get weaker, and you want to stay balanced all the way around. What I usually do here for massage is get in between the ribs right along the sternum, in the upper part of the sternum, and kind of clean out that place of any tension. Surprisingly enough, there's a lot of tension that happens in this area because we reach and stretch a lot. This is the pectoralis muscle, and as you can see, you can really get under it pretty well. And behind that is ribs. Down into the arm is ribs. When we can take people into really deep states of relaxation, the body's able to turn off the stress hormone production. The nervous system gets a chance to be somewhat sedated and relaxed. But turning off those stress hormones, the adrenaline and some of the other hormones that are produced during stressful times, whether it's good stress or bad stress, where we have a lot of stimulus coming in these days. So this is a really good preventative type of therapy to keep yourself balanced, to keep yourself relaxed, to keep the body from overproducing a lot of that stress stuff, because when we're under those states of being, we can't think as clearly. We get easily sidetracked. We have just a harder time focusing. And the top part of the clavicle, which also has a fair amount of lymph nodes underneath this. I'm right on the bone here, feeling for the attachments. That might be a little rough. We did a neck massage the last series, so I'm not going to go into the neck very much here. And I'm going to check the sternum. Now there's a lot of roughness. And that's probably from her guitar, holding her arm over the guitar and strumming it. Feels a little tight in through here. Now when we do lymphatic work and we want to drain the lungs, I can show you this. You just take your hands and press in and up to drain the lungs. And you can also drain the pleura, which is the sheath around the lungs. That drains a little bit different direction. When you go in, you energetically feel, the pleura will feel kind of slippery like a membrane, but when you get into the lungs, it feels more like a sponge. It's spongier, so you can pick up a different feeling. And then you can also feel the movement of the lymphatic fluid when you know what to feel for, what to tune in for. Let's do some nice stretching. The jawline gets quite tense. That's another place that we hold our tension, which is why the mouth work is also nice, because getting from the inside and allowing the bones to relax from the tissues, from the musculature. We'll relax the jaw and allow it to move into another position. And this is just basic massage technique. If you are a therapist out there, you'll just find what works for you. Usually we find different things that work and that are effective, and we tend to lean towards that. As therapists, and even as other healthcare professionals, we shouldn't be in a situation of competitiveness with one another, because we all have something to contribute to this if our intention is in the right place. We don't need to have the corner market on it. If I see 4 to 5 people a day, I'm fine with that. If I find that I can't really bring somebody to a space that's going to help them, I have a lot of people that I can refer them to for other work. Sometimes they need to have a chiropractor fix something. Sometimes they need to have just another thing done. And I think that if we can adapt that to that as therapists, we could possibly create a new way of how we're looking at our health services in this country, where we can begin to make the person, the patient, the client, the reason that we do this, and not prescriptions or surgeries or things that are more damaging on the body. The body is really quite easy to take care of if we know what to do, if we're good to it, and if we know not to be excessive in certain things. We should be able to have fun, enjoy things, enjoy life, and be healthy. So I would like to also put out there for therapists and other healthcare professionals to remove that competitive edge or thinking somebody else's work isn't as valuable because it's not done the way that they or so-and-so thinks it should be done, but rather that it's getting people better, it's getting them out of pain, it's correcting conditions, it's giving them back their life. And if we're doing that as a community, as a healthcare community, then we're doing our job. But the job really is more in training people how to take care of themselves, because ultimately it's not the government's job to have health care for us. It's our job to be responsible for our own health. And if we want to live in a free society, we have got to begin to take on those responsibilities. Because being healthy can be such a wonderful experience. And getting there can be a little bit tricky, but you can make it if you keep pointed in that direction. So that's just a little relaxation work that I do oftentimes at the beginning or at the end of other work that is going on for that particular session.
Thank you for sharing. Thank you for subscribing. And I think there's a little bell up there that you can hit that you'll get a notification every time we post. So if you want to, you can hit that too. But thank you so much for your support. I really appreciate it.